This next topic on blood vessels is going to review some circulation and go into fetal circulation. So you might recall earlier we had spoken about pulmonary circulation. And pulmonary means lungs. So pulmonary circulation is when the blood goes from the heart to the lung, picks up the oxygen, and then returns to the heart. So right here you can see it, heart to the lung, picks up oxygen, so blue to red, and then returns to the heart. The second circulation we had talked about was coronary circulation. That's when blood leaves the heart through the aorta, supplies the heart walls with muscles on the outside, and then returns back to the heart. And then last was systemic circulation, and that's shown here, blood going out the aorta and going to the entire body. The body uses the oxygen and then returns the deoxygenated blood back to the heart. So those were our three circulation pathways we've talked about with the blood vessel. Now I want to introduce to you fetal circulation and show how this is going to be slightly different. So with the fetus, the lungs are not developed. So the issue is we don't have this pulmonary circulation. So in fact, we want to basically cut out the vessels that go to the lung or somehow bypass the lung. So here's what's going to happen in fetal circulation. Here we have the heart, right? And then here are the lungs that are developing. But the fetus doesn't get its oxygen from the lungs, right? Because the fetus isn't breathing inside the mom. Instead, the fetus is getting its lungs from the placenta. And the placenta provides the umbilical cord right here, and the umbilical cord brings the oxygenated blood to the fetus and to the heart. The heart still pumps, the blood circulates, and then the deoxygenated blood, you'll see here, returns through the umbilical cord back to the placenta. So the key here is the blood supply with the oxygen is coming from the placenta and being returned to the placenta. So what we're going to do is have two umbilical arteries. Remember, arteries leave the heart. In this case, when they're leaving the heart, they have no oxygen, and they're going back. You notice right here, these two right here in the purple are going back with no oxygen from the baby back to the placenta. So there's two of them. You have one umbilical vein with oxygen going from the placenta to the baby. And so that's what in here in red. Remember, vein means returning to the heart. So in this case, this vein, which is oxygenated with blood from the placenta, is returning to the heart. This one umbilical vein is going to the heart, bringing the heart oxygenated blood. So that's how, again, the fetal heart is going to get its oxygen and return the deoxygenated blood. So here's a true or false question for you. A fetus will use its lungs in the womb. In other words, is a fetus breathing inside the mother's uterus? Okay, the answer is false. We had mentioned it briefly before. Their lungs are not fully developed, so they're not going to use their lungs. So this next part, I'm going to talk about the fetal circulation and how we bypass the lungs. And there's actually two ways, or two shunts, or bypasses for the lungs. In other words, we'll avoid the lung. All right. First is through a structure called the foramen ovale. And this foramen ovale is a hole. Foramen, you might remember, means hole, and then ovale, oval. So this oval hole goes from the right atrium directly to the left atrium. And let's think about why this is important. Remember, the flow of blood through the heart, the blood circuit, normally goes from, look down here, right atrium, down to right ventricle, from right ventricle out the pulmonary valve and pulmonary trunk to the pulmonary arteries to the lung. So the key is we never want the blood going out to the pulmonary trunk and arteries to the lungs in the fetus because there's no lung to be used. So by taking this bypass, going from the right atrium directly over to the left atrium, notice we completely pack the lungs, because from the left atrium, remember, you drop through the bicuspid valve into the left ventricle, you pump the blood out of the left ventricle through the aortic valve and the aorta to the body. So notice here, we did not use the lungs by going from right atrium directly to left atrium. Another option is using the structure called the Ductus Arteriosus. And this is right here, it's a little vessel that goes directly from the pulmonary trunk, which is right here, and then see this little blue vessel right here? It jumps over and directly hooks up with the aorta. So you go from the pulmonary trunk to the aorta. So let's review why that would be important. Okay, starting with blood, right atrium, falls through the tricuspid valve into the right ventricle, and usually from the right ventricle you pump through the pulmonary valve, pulmonary trunk, which usually splits into two pulmonary arteries to the lung. But again, we don't want to do that. So from the pulmonary trunk, we go directly to the aorta, and then from aorta to the rest of the body. So again, we skip the entire lungs and the left side of the heart and go directly out the aorta. So both of these options, using the foramen ovale or the ductus arteriosus, that leads you to bypass the lung and therefore continue on with the circuit without the lung. So when the baby is born, of course, it needs to immediately start using the lungs. And that's why you'll kind of get that cough and the screaming in the beginning as you get the fluid out of the lungs and you start using the lungs right away. So once you start using the lungs, it's important that the blood does go through the lungs like the normal adult circuitry. So we no longer want the foramen ovale, right? If you still have the foramen ovale, then deoxygenated blood on the right side will mix with oxygenated blood on the left side, and then you'll end up pumping some deoxygenated blood out the aorta into your body. So that's no good. So your foramen ovale should close, and the remains of what you see is called the fossa ovalis. So that fossa is just a little indentation you see in the right atrium where the foramen ovale was. Now you might have heard, oh, that baby was born with a hole in its heart. Well, the hole in its heart is actually the foramen ovale, meaning that it didn't close up all the way. So it's not completely uncommon for a baby to still have a little bit of that foramen ovale present, and then eventually it'll close up into the fossa ovalis. So that's the hole in the heart. The second bypass, the ductus arteriosus, should turn into the ligamentum arteriosum, and that's just a hard ligament that no blood can flow through. So that's, again, closing off that second passageway right here. So instead of going from the pulmonary trunk directly to the aorta, because again, that would bring blue deoxygenated blood mixing in with the red oxygenated blood in the aorta out to the body, you close that up into the ligamentum arteriosum. So just to summarize the blood vessel, arteries, capillaries, and veins have layers and specific functions. Fetal circulation serves the fetus and is modified after birth.